Minister of Parliamentary Affairs and Governance, Honourable Gail Teixeira, and Minister of Health, Honourable Dr. Frank Anthony, recently hosted a meeting with representatives of political parties on the COVID-19 public health situation. The ministers also sought the parties' assistance in encouraging the public to get immunized against COVID. The meeting was held at the Arthur Chung Conference Centre. Minister Teixeira noted her preference for additional methods such as joint multi-party statement and a collaboration between parties for outreaches to communities which have not been substantially vaccinated or are hesitant to do so.
The Ministry of Health has been working very hard and health teams traveling across the country, and so it is very sometimes difficult for them when they've gone into some locations that people have said, no, we don't want you here, we don't want the vaccine. And so it is to try to encourage, to inform, because we believe there's quite a bit of misinformation out there, quite a bit of noise that is confusing people.
Director of Primary Health Care at the Ministry of Health, Dr. Ernesta Hamilton, informed the meeting of the recent developments in government's efforts to maintain public health and safety and its battle with vaccine hesitancy and misinformation. Dr. Anthony appealed to the parties to help, noting that the government is ready to commit resources to improving the response.
Our appeal really is, let's get as much people to get vaccinated as possible. We have the technical people. So far, I think we have enough. If we go on an accelerated rate, we might have some challenges, but I'm sure the staff is willing to go that extra mile. And you know, we can do this. As a country, if there's any time that is more important for us to work together, it is now.
The parties engaged in discussions and offered suggestions on how to improve the response to the pandemic. At the close of the meeting, they agreed to make separate appeals to their supporters. Party leaders will also coordinate with the Ministry of Health to record brief messages which will be aired on the radio, television, and online.